Hello and welcome dear students, learners and professionals to the another very interesting video, that is dissolution testing 2-point release specification. So in this video we will discuss and we'll understand why some of the products have 2-point dissolution specification or 2-point release specification in the dissolution testing. So first of all, what is 2-point release specification? See, whenever there is a requirement of release specification at two different time points for the drug release, then it is called as 2-point release specification. That is dissolution specification with two time points for drug release for some of the drug products where dissolution is not achieved. Dissolution is not achieved means in some of the products the dissolution is not achieved with standard dissolution conditions, like for example basket apparatus or paddle apparatus with 900 ml of media and specific RPM and the time points. So in some of the products dissolution is not achieved till the 45 minutes. That means the release is below 80% or below 70% till the 45 minutes. That's why there is a need of two time point dissolution. So for example, this is a hypothetical example I have considered here to let you understand about the 2-point dissolution specification. First time point for 15 minutes with release between 40 to 60%, and the second time point for 60 minutes with release of not less than 70%. So first time point is 15 minutes and second time point is 60 minutes. So the drug product should pass these two time points for dissolution specification. These type of dissolution specifications are available in the monographs also. Then when the 2-point specification is required, when there is a need, so 2-point release specification is required when the drug is poorly soluble. That means if the drug is poorly soluble and if the dissolution is not achieved within 45 minutes or at 45 minutes for the percent release of 75% or 80%, that time 2-point release specification is required. It is also required for slowly dissolving drugs. Some drugs are soluble. If you check the solubility, these drugs are soluble, but they are comparatively slowly dissolving. That's why the time required is more, and sometimes the formulation are slowly eroding and releasing the drug at a slower rate. That's why the 2-point dissolution is required. See, some of the products are not the MR product. They are not having any MR design. That is modified release, prolonged release or controlled release design is not there. But due to the use of some excipients, some polymers, these formulations erode very slowly, and that's why the dissolution is not achieved. Some of the time for some of the products, slower dissolution is required to have bioequivalency with the reference product. For those products also, two time specification is given. Then the release is not possible with standard dissolution conditions. This is we have discussed. The release is not possible with standard dissolution conditions. That time we have to give 2-point release specification. Now see, the first point is having a dissolution range or dissolution window, as we have seen earlier, window of 45 minutes. Sorry, at 15 minutes it is 45 to 65, or you can consider 40 to 60 for example, and at later or second time point it is to ensure the complete release. There we have to give dissolution specification of, for example, not less than 75% or 80%. The 2-point specification is required to have uniform product quality. Then it is also required to have discrimination between the bio batches and the routine commercial production batches. It also required for biorelevancy of the dissolution method or dissolution testing condition with the bio batches. So these are the main important points. For example, we will see here the dissolution specification of USP monograph for carbamazepine tablets 200 mg. This is the example I have taken from USP monograph for carbamazepine tablets. Test 2 is given: medium water containing 1% SLS or sodium dodecyl sulfate. Media is 900 ml and apparatus is paddle, apparatus 2 at 75 rpm. Still the 60-minute time point is not less than 75%. If you see here, that means this product with the standard dissolution conditions, the product is not releasing the API. That's why the 2 time points are given. First is 15 minutes, that is having amount dissolved of 45% to 75%, and second time point of 60 minutes, that is not less than 75%. Then coming to the acceptance criteria, USP monograph gives the acceptance criteria for carbamazepine tablets 200 mg with the reference of dissolution chapter 711 and with the following exceptions. See here, at 2 time points the acceptance criteria is given at 15-minute time point and at 60-minute time point. At 15-minute for L2, no unit is more than 5% outside the stated range, and at L3, no unit is more than 10% outside the stated range, and not more than 2 units of the 24 units are more than 5% outside the stated range. This is the criteria for 15 minutes. Then at 60 minutes, at L2, no unit is less than Q minus 5, and at L3, no unit is less than Q minus 10%, and not more than 2 of the 24 units are less than Q minus 5%. So this is the standard criteria for 2-point release specification for this product. Another is example of venetoclax tablets. I have taken it from the US FDA Biopharmaceutics review for venetoclax tablets, and I have referred here because this product is not presently listed in the USP monograph or any monograph, but it is available in the US FDA Biopharmaceutics review. So for study purpose I have taken here. For this product, USP apparatus 3 is used with dips per minute of 20. So 20 dips per minute is the speed, and here medium is 250 ml of sodium phosphate buffer 6.8 with SLS 0.4% and anti-foaming agent. So 3 strengths are there: 10 mg, 50 mg and 100 mg. For 10 mg, 1.5 hour and 2 hour, these 2 time points are there. Then for 50 mg, 2 hour and 3 hours are the time points, and for 100 mg, 3 and 4 hours are the time point. But this product is not a ER product as per the label. For this video, I have referred the product labels. Then OGD dissolution I have referred from US FDA, and I have referred USP monographs. So in summary, we have studied the requirement of two dissolution time point specification when the API has low solubility or the slowly dissolving API are there in the formulation, and sometimes the formulation is itself slowly eroding, or sometimes for the biorelevancy requirement or bioequivalency requirements or discriminatory dissolution requirement, the two time points dissolution are given to the immediate release products. These products are not claiming that they are modified release. So this video might be helpful to you to understand the two time point release specification in the dissolution testing of oral solid formulations. So please like, share and subscribe to this channel for more incoming informative videos. Thank you.